hope that you and your families are well, and you missed us coming into your living rooms yesterday. Your government has been hard at work, and I'm happy to be joining you again today to provide you an update and to answer your questions. Today, we will have the latest update from the Ministry of Health on the current number of cases on island, and the Minister of National Security will provide an update on matters surrounding the shelter in place. I will then touch on some matters relevant to small business and will be happy to take questions from the media. There has been no greater champion of the importance of testing than myself. From the beginning of this pandemic, and even before it was declared as such, I have been convinced that the only way to adequately respond and make it through this pandemic is to test, test, test. From the early days, that has been our focus. And I now know far more about molecular testing than I ever dreamed I would. The knowledge that widespread testing brings informed decisions that we are required to make as a government and increases the understanding of our community. And the simple fact is that widespread testing is a necessary prerequisite to open our economy. So no one is more disappointed than I am when we have not been able to test as aggressively as I know that we need to. It has been an uphill battle to ramp up testing, full of disappointments of which I shared with you earlier, but I'm confident that we have turned that page and can do the testing required for us to be better informed about where we are as a country. There are identified high-risk areas, and throughout this period, I have consistently focused our policy to ensure that this demographic is tested to protect the vulnerable, to protect those who care for them, and to protect their families. I believe that the Ministry of Health sees the value and importance of testing, and so this meeting of the minds between policy and the administration is critical to advancing the testing regime so desperately needed now. Though we have tested a great deal of persons, we certainly need to test more. Today, as some have done, we can point fingers. Today, as some have done, we can seek to assign blame. Or today, we can do, as some have sought to do, to extract that pound of flesh that some may find satisfying. Or we can fix what went wrong and move forward. Make no mistake, despite the hard work that each and every member of our team, and despite the fatigue and stress that we are all under, we recognize that when we make a decision, people's lives depend on that decision. And if a decision is made that may not be in the best interest of the country, people could get sick and people may die. That weighs on us and it weighs on me every single day. There are some in Bermuda who will seek to return to the pre-COVID-19 atmosphere of petty politics as usual. Do what you feel you must. Right now, my interest is not in scoring political points and not in gaining that political advantage. Our sole interest is in saving and preserving lives. With every day that passes, we learn more and more about how we can manage this pandemic. We have listened and remained flexible, enabling us to adapt quickly and to respond whenever we identify a different or better way to do things. We are humble enough to say when we don't know it all, and strong enough to say that despite this, we take responsibility for everything that happens on our watch. That is why I'm so gratified that when we have asked for help, like when we needed assistance in locating swabs, there were those in the community that assisted the country. On Friday, we will launch a multi-lane drive-through facility at Southside that will begin to test our essential workers. This is made possible due to the dedicated efforts of Dr. Karika Weldon and her team of young Bermudian scientists. For many years, young Bermudians have fought to be recognized for their education, their intellect, and their talents. I know full well, as I used to be one. However, with my mature gray look, I am pleased and proud to say that this dramatic increase in testing is as a result of Dr. Weldon's passion and love of country. She's a product of the Bermuda Institute, Port Royal Primary School, and Warwick Academy. She achieved her Bachelor's of Science with honors in medical biochemistry and a PhD in biochemistry from the University of Leicester. Dr. Weldon, in a Burr News interview, stated, and I quote, "I am the product of the rock and home island which I love so much. I am a young, black, Bermudian biochemist who is set to conquer the world of science, one step at a time," end quote. When your country is at war, like we are versus COVID-19, we need all hands on deck. That means the old way, telling young, educated, intelligent, talented Bermudians that they are not good enough, that they need to stand on the sidelines and they need to take their talents elsewhere to make a meaningful contribution, is over. I am grateful that Dr. Weldon was willing to return home and contribute her talents on the war against COVID-19. The results speak for themselves, with the over 200 results delivered from the Bermuda Government Molecular Diagnostics Lab for the testing done this weekend. I am thankful to her and the entire team that have made our increased testing capability possible. As leader of this country, I will continue to celebrate our young people, our talented young people, as I know far too well what it's like to be celebrated overseas, but having to fight for respect in your home country. Not in the Bermuda that I lead. And if it takes this virus to turn that page, then our country will be the better for it. Now, the Minister of Health will provide an update from her ministry. Minister?
Good afternoon. Today there were 17 test results received and 1 was positive for COVID-19. Bermuda now has 99 total confirmed positive cases. Their status is as follows. There are 55 active cases, of which 44 persons are under active public health monitoring and 11 persons are hospitalized. A total of 39 persons have now fully recovered, and the total deceased remains at 5. The average age of all of our confirmed positive cases is 56, and the age range of all of our positive cases is from 18 to 91. The age of persons hospitalized ranges between 57 and 91 years, and the average age is 74. As the public is aware, 3 confirmed COVID cases were found at Westmeath Residential and Nursing Home. We have been working closely with the administrators since the first case was identified on the 10th of April and have now started the process to test all residents and staff. As was said yesterday, the first case was identified on April 10th, and that individual has been in quarantine until today. All close contacts were also quarantined. Guidance was given by the Ministry of Health to the home to quarantine 4 members of staff who had been in close contact with that individual. All staff were monitoring their temperature daily, wearing a mask throughout their shifts, and wearing work uniforms during working hours only. Since then, there were 2 further cases identified on the 14th of April and the 20th of April, respectively. I know that there are questions about why the entire home was not tested earlier, with the first case identified on the 10th of April. When it occurred, case criteria was not met given the testing capacity at that time. And as you've heard the Premier mention, we have now the second lab, as well as we have quite a number of testing materials and supplies that have arrived in the last 10 days. The second case was unrelated to the first and isolated fully. It is now that we have the capacity to test more extensively, and that is what we are doing. Further actions taken by the Ministry of Health Epidemiology and Surveillance Unit with respect to providing support to Westmeath include meeting with the acting executive director, provided guidance on the strategy to manage the outbreak on receipt of tests and other investigation results. PPE training is also being arranged. Supplies are being provided as needed, working with the home with respect to infection, prevention, and control practices. Additional outbreak control and mitigation measures are also as recommended below, keeping families, staff, residents informed about the outbreak. And to that end, no new resident admissions are allowed until the outbreak is over. monitoring residents for any new respiratory symptoms such as cough, shortness of breath, or fever, quickly identify and isolate any resident with symptoms of acute respiratory illness or fever, and report any suspected COVID-19 illnesses or new respiratory illnesses or fever in any residents or staff to the Ministry of Health, discontinue all non-essential activities, discontinue all communal activities and gatherings, and where possible, encourage family members to keep in touch with their loved ones by phone or video chat or other technologies as available. As has previously been explained, testing capacity is complex, and Bermuda has been in a challenging position due to the global shortage of supplies. We are relieved that we now have more extensive capacity for testing and are able to ramp up our testing regime. The Ministry and the Bermuda Health Council have been working diligently with all care homes on the island to control the spread of the virus amongst our most vulnerable. And having increased our testing capacity this week, we are now undertaking to also continue with conduct testing in all of our rest homes as a matter of priority. And I can say that Westmeath, the residents were all tested today, as well as the staff that were on duty. We will continue testing the remaining members of the staff as soon as possible, and the results of those testing will be provided between 24 and 48 hours to the doctors of the residents of Westmeath. Thank you.
Thank you very much, Minister Wilson. Now the Minister of National Security will provide his update. Minister.
Thank you. Thank you, Premier. The Bermuda Police Service continued to execute arrests for the shelter-in-place breaches, primarily for overnight curfew offenses. However, the arrests are lower in number than 7 days ago. The daily community advisory points continue across the island, supported by the Royal Bermuda Regiment and the Bermuda Police Service. On Monday, there were 11,477 stops, and yesterday, Tuesday, there were 10,786 stops. The Bermuda Police Service are focusing on our seniors. This week, the Bermuda Police Service visited a number of seniors to ensure that they were safe. Anyone that is concerned about a senior who they have not seen recently, please contact the Bermuda Police Service and make inquiries. The Bermuda Police Service have also seen a rise in online scams. Further advice and guidance can be obtained via the government's CyberTips website, www.cybertips.bm. Also, the police are still looking for Mr. Robert Douglas, who's been missing since March 24th. Please be advised that Mr. Douglas suffers from Alzheimer's, and he is the father of 4. If anyone knows where Mr. Douglas is, or if anyone has seen him recently, please contact the Bermuda Police Service on 295-0011. Our disaster risk reduction and mitigation team have recently completed managing 5 of the island's government quarantine facilities. Over the course of this week, including tomorrow, individuals who have been housed at these facilities have either been, 1, discharged to return home with specific guidelines from the Department of Health, or 2, if they have not received the all clear from the Department of Health, they will continue to quarantine until such a time that approval is given. The Disaster Risk Reduction and Mitigation Team is now in the process of preparing to receive the returning residents on the British Airways flight, which arrives on Friday evening. The Durham team will work closely with the Customs Department regarding the landing process. Please note, passengers will be landed airside by the Immigration Department to minimize contact with our customs officers. The Customs Department will work alongside the Port Health team as needed. From a safety point, each officer conducting inspections will have on the appropriate personal protection equipment, or PPE. I want to take this opportunity to extend my sincere appreciation to the Collector of Customs and our leadership team, and to each and every customs officer working to ensure that the critical services they provide run smoothly. The Ministry of National Security is appreciative of your dedication and your sacrifice, and again, we say thank you. Turning to the shelter in place, approvals for businesses to operate are as follows. 71 businesses have been granted permission to operate. These businesses have very strict guidelines, and these guidelines must be adhered to at all times. If any business deviates from any of the guidelines, they will be immediately shut down. The public can visit the government website on www.gov.bm/coronavirus-forms to see what businesses have been granted permission to operate. Any business that opens contrary to the emergency powers shelter-in-place regulations will be liable to prosecution. I can advise that starting tomorrow, bailiffs and traffic wardens will be out ensuring that approved businesses across the island comply with the COVID-19 exemption regulations, such as social distancing and correct opening and closing hours, amongst other things. Turning to the Department of Corrections, our officers continue to operate on a reduced regime. Visits to corrections facilities by vendors and other external agencies, including government departments, have been put on hold unless it is an emergency and these visits are approved by the acting commissioner. Additionally, non-security staff continue to work remotely. Please note that staffing levels have not been impacted and staff continue to carry out their duties professionally despite the challenges that they face. In lieu of face-to-face visits, virtual visits for the inmates commenced last week and they have been well received. Questions were asked in the press last week, and I would like to highlight the following. There is sufficient hand sanitizer in all of the facilities. All facilities and officers have sufficient PPE kit. If they run out, they will be supplied by the Ministry of Health, who have indicated there is enough PPE kit for corrections officers. Hot water in the Westgate Correctional Facility is working. The acting commissioner has a pandemic plan. Should the situation change, the team will adjust their positions and morph the plan. Lastly, I would like to extend heartfelt thanks and gratitude to all of the officers on the front line working to keep Bermuda safe. As a ministry, we must do and we will do all in our power to protect them. I can confirm that over the next few days, we will begin to test all members of the uniformed services for COVID-19. This includes the Bermuda Police Service, the Royal Bermuda Regiment, the Customs Department, the Department of Corrections, the Bermuda Fire and Rescue Service, and the Department of Immigration. Premier, thank you.
Thank you very much, Minister. Last week, Erika Smith, the Executive Director of the Bermuda Economic Development Corporation, was here giving details of what the organization is doing to help small and medium-sized business. The government's primary focus during COVID-19 is to limit the possibility of the transmission of the virus, to ensure that it does not overwhelm our healthcare system. It is not to thwart economic activity. We are aware that prior to the shelter-in-place, several retailers made arrangements to be able to fulfill orders while at home, essentially becoming a home-based business. It is to be noted that according to the law, home-based businesses can still operate if they are using approved delivery services. It's important to note, clearly, if you're a home-based business, no one can visit your particular home. There are approved delivery services that can be contacted to be able to pick up orders from your home and deliver to you. As Minister Kane said, the listing of approved services can be found on the government website, which is a dynamic form which will be automatically updated once new services are approved. And I've asked the minister to also make use of our taxi drivers who are at home right now, in many instances collecting unemployment benefits, and we want them to make sure that they can take advantage of the opportunity to try to deliver more items as we begin to gradually allow more economic activity. However, I do recognize the challenge of Bermuda-based small businesses when they see courier companies advertising for locals to order online and bring items into Bermuda when they cannot shop locally. And that, of course, defeats the purpose of us trying to work together as a unified country. The reason why shipping and freight companies were opened up were to clear items off of the docks, as there were a large number of containers that were backing up. And this was for persons who bring in larger items through the docks with freight forwarders. The reason was not to allow persons to engage in new rounds of online shopping for things that they cannot buy in Bermuda because the stores are closed. It is important that the Bermuda Economic Development Corporation and the government of Bermuda support our local online business. And therefore, what I've asked is that the Minister of National Security ensure that all new non-essential packages that are coming in through air courier services may not be cleared until after the shelter-in-place has gone up. And also, we are looking to, and this is a conversation that we had in Cabinet yesterday, which I've asked Bermuda Economic Development Corporation to do, is to look at how we could possibly allow small businesses that are only staffed by persons from a single household to be able to possibly go and fulfill orders that may be placed online so they can go ahead and participate in economic activity. The reason why I say that it's important to recognize persons from not more than one household. Transmission risk happens when you have persons that are intermixing from various households in a particular location, and then they go back to their own households. If there is, for instance, a business that is operating where there's persons from one household, that is something we may be able to allow. And of course, that will be able to happen under regulations after shelter in place. But over the next week, the last thing I want is for local Bermudian small businesses to be disadvantaged. And that is not the spirit of what we were trying to do. Additionally, the Bermuda Economic Development Corporation has worked tirelessly to provide small and medium-sized business with sustainability and business continuity package, utilizing the $12 million in funding from the government. In addition, they'll be using their existing $12 million capacity to provide small and medium-sized business with loan guarantees and overdraft guarantees for a total of $24 million in support. Now, I understand that some business owners have expressed frustration with the fact that the grant funds that have been allocated are tied to a loan. And I can appreciate the frustration that some may feel. And I recognize every day in this job that unfortunately we will not be in a position to please everyone. I would like to note that to date, the Bermuda Economic Development Corporation has received requests for support for over 150 businesses. And thus far, many of those requests came in prior to the grant component being provided and announced as it was on Monday. For those that say they need a grant, I'm here to clarify that the first deployment of Bermuda government grant relief to business was by way of the unemployment benefit directly distributed to the employment of businesses island-wide who were closed down. This relief has been a great help to businesses faced with trying to figure out how to assist their employees during this trying time. Second, if you apply for a business sustainability and continuation loan and grant program offered through the BEDC and you are approved, half of the money of which you receive will not have to be paid back. Therefore, in effect, you are receiving a grant. Let me give an example and to clarify how this works. If you are a small business that has an annual revenue up to $100,000 and have less than 3 employees, then you can borrow up to $10,000. Of the $10,000 that you receive, you will only have to pay back $5,000 at an interest rate of 3.5%. With a payback of 42 months, the monthly payment is $122.66, and total interest paid would only be $319. The first loan payment is due 3 months after the disbursement of the funds, and then the next 3 months are interest only at only $15 a month. The business can then ask for an extension for interest only for another 3 months, so it is conceivable that businesses may not start repaying these loans until 2021. As you can see, this should be very achievable for most businesses that have plans to continue to operate post-COVID-19, and from the number of applications received for help, we think that a majority of the business owners in Bermuda are grateful for this assistance program which has been launched. We are all in this together, and as an entrepreneur, I recognize that COVID-19 is no one's fault, and the way in which we come out on the other side of this pandemic in a positive way has to be a joint effort. The government is giving support, and we would hope that the business community will continue to give its support as well. We want to help you during these times, and it is important, and that is the reason why we have made $12 million in funding available through this loan and grant program. The Bermuda Economic Development Corporation will provide the public updates on a regular basis on how many businesses have been approved, what size, what industry, what bands, and the split between direct loans, direct grants, guaranteed loans, and guaranteed overdrafts, so you're aware how these funds have been distributed. And I'm pleased that they have come up with this program, and I'm certain that this program will certainly be better than the assistance that persons may receive if they were going to a commercial bank. Going to the third sector before I close, I'm pleased to share with you that over $1 million has been raised for the Bermuda Emergency Fund, with more monies coming in every day. This money has almost been fully allocated and earmarked to help Bermudians during this unprecedented time. Every week, more than 7,000 meals, grocery vouchers, and bags of groceries are being distributed. Safe spaces for victims of domestic violence are available. The homeless shelter is serving many people in need every night, and there are success stories that the Minister of National Security can share from those persons who are receiving mental health treatment and counseling at our shelter. Funds are being used to support these and other essential services to Bermudian families to help them get through these difficult times. Thank you to all of the corporations, families, and individuals who have contributed this life-saving emergency effort, including sourcing and funding extra support for the hospital, seniors' homes, and to the providers of key services to our vulnerable population. Thank you also to all of the nonprofit organizations that work hard to deliver critical and essential services, ramping up their programs to meet client needs and to serve the larger community. And whilst we are attending to these emergency needs, we must not forget that there are services and programs that will be important to our vitality as a country when we emerge from shelter in place. These service providers are making the shift to virtual technology and finding new ways to deliver enrichment programs, youth development activities, together with services for people with disabilities and special needs. Words cannot adequately express how I feel to see the entire country coming together to make a difference for those in need. When I think of hurricanes and how we gather as a community to make sure we're all taken care of, this period in our history has shown even greater unity and sense of purpose, and we have a strength and generosity of spirit to help each other. Before I take questions, I would like to once again thank everyone involved in protecting the health and safety of our community. Thank everyone involved for keeping our community fed and sheltered, and thank everyone who is living up to the adage that I am my brother's keeper. Now, as I share at the end of my statements, I get in trouble for not thanking everyone, and it is impossible to thank everyone, and so I get messages, well, you didn't thank me today, you didn't thank me today, all the rest. I do want to say a special thank you to the team that actually works for me and has been working incredibly hard, and that is the government's information, the IT team for the Information and Digital Technologies team in the government of Bermuda, and also the digital services team within the Department of Communications, who has worked so hard to transition the government to an online government. When you see these forms which are being created, when you see the dynamic listing of permitted companies that have been put in place, when you see the fact that the government is communicating over WebEx and making sure that the government functions continue to run and making sure that we ramp up online services, there are a lot of hard-working men and women who are working long hours and late hours to make sure that happens. And I just wanted to extend to them my personal gratitude. They get called out at all hours of the day and sometimes in the morning to make sure that we can get our meetings done online and make sure that the technology can continue to work. They were responsible for making sure we had our online parliament last week and continue to work very hard. So I just wanted to express a word of thanks to you. Before I take questions, I would ask us all to continue to pray for the families who have lost loved ones, and also to continue to pray for those who have confirmed positive with COVID and are battling the disease, whether they be in hospital or at home. Thank you.
Good evening, Mr. Premier, Ministers. Paul Johnston from the Royal Gazette. I'll do my best to speak loudly.
Thank you.
In the press release last night, the Ministry of Health said that testing of all residents and staff would begin at Westmeath today. Minister Wilson, you said tonight that this didn't take place immediately because case criteria was not met given testing criteria at the time. I'm wondering if you can explain specifically what that means.
Okay, I'm going to actually, I'm joined by the Chief Medical Officer and also Dr. Armstrong. And
Did you finish, Minister? Okay, I wasn't certain if you were going to give an answer there. The question again, so I'm clear, is that you asked why didn't the testing at Westmeath occur when?
Well, last night we were told that the first case was confirmed on April 10th.
Okay, yeah.
Minister Wilson said tonight that testing of residents and staff did not immediately take place because, and I quote, case criteria was not met given testing criteria at the time. I'm trying to figure out what that specifically means.
Okay. April 10th was the date that we identified a case. Testing is one of a handful of public health actions that occur at the identification of a case. At the April 10th date, the details of the case did not warrant testing. I assume you mean the entire rest home, the entire population of residents and staff. And so without giving intimate details of the person who was identified as the case, I can say that what is done ordinarily is to assess the actual history, the history of attendance at a rest home, the history of intermingling between a case and either residents or other staff, and a determination is made what is appropriate in the way of testing, so that there is no knee-jerk or automatic reaction if you identify an individual, a staff member particularly, with COVID-19, that one should test everyone in the facility or everyone who works at the facility. The indication is that there should be a case investigation, which was done and which is done in every instance where there is a case. And then the determination is made at that time who is appropriate to test. But public health action takes place immediately. Public health action didn't start today when the testing started. Public health action includes isolation of the case, assurance that the investigation proceeds quickly so that anyone exposed, that is through contact tracing, anyone exposed is then assessed. And anyone exposed might also, like the case, be tested. But the question you're asking is, why wasn't everyone tested? That's because that is not a state of management of rest home facility outbreaks. So I hope that answers your question. Maybe you can refine it further.
How does that gel with the fact that 2 additional positive tests were then confirmed afterwards then?
As it turns out, our investigation has indicated that there is no connection between the first case and the additional cases. So our investigation does not add up to your assumption that it was the first case that resulted in the other 2 cases. And this is an example of why we so strongly hesitate to get into the details of case investigation, because in a small community such as this, it doesn't take very much reverse engineering for people to figure out what actually happened and who is actually being investigated, and really invade unnecessarily the privacy of the people involved. The situation that you describe, a case happening, and then later, I don't know, maybe 12 days later, I'm not sure of the details, other cases being identified, those are not necessarily connected. And I'm here today to reiterate the fact that, in general, public health will not be divulging the intimate details of a case investigation so that anyone other than those involved can identify what was done and wasn't done and why it was done and why it wasn't done. The individuals who are affected by a case are contacted immediately. That is the public health action that is appropriate. The reaction of testing everyone is not a solution. What that is a reasonable act when it is appropriate. It does not change the safety or the risk that people have. So the investigation has to proceed, and that is private. And unfortunately, for everyone's curiosity, we're not able to divulge the details of an investigation, the outcome of an investigation. We can't, we don't want to name the individual that might have introduced an infection into a setting. And so what you see and the assumptions you make you assume that certain things should be done or shouldn't be done, and it's erroneous. And so for reasons of privacy, we're just not going to ever get into the details of a case investigation, and we're certainly not going to justify actions, because to do that requires divulging information that's really of a private nature and is of no benefit to the general community. Now, what we are going to do, because there are so many questions around every instance of COVID-19, the Epidemiology and Surveillance Unit recognized there is a gap in understanding of what public health outbreak investigation involves. And so very shortly, we are creating a series of 5-minute infomercials or PSAs to really help people understand the particulars of case investigation, outbreak investigation, contact tracing, and case management, all of which are far too detailed to have discussion on in this setting. But I think people do need to understand it so that their questioning is more in line with the reality of what public health practice should entail.
Appreciate that. The Ministry of Health release last night put the number of positive cases of COVID-19 associated with care homes in Bermuda at 31. We've heard previously that Matilda Smith Williams has 27 cases, and last night we learned that Westmeath has 3. That totals 30. Which home is associated with the 31st case?
I think that you heard the Chief Medical Officer very clearly say that she's not going to divulge that information. But I thank you for asking, and I don't know if you want to
Yes,
add anything
and
to it.
I'm not even sure of those numbers. I can say that very easily it can be
you're not
double
sure
counting.
on the numbers?
I'm not sure of what you just said. That you just recounted some numbers, some
Yes.
figures, and I'm saying I don't have in front of me that information to corroborate what you're saying.
Fine.
But if the numbers don't add up, there is a reason. I can't say right tonight what the reason is.
Is somebody able to confirm that there are positive cases or a positive case at a third home not identified?
That is not something that I know about, but we can certainly look into it. You're asking whether or not the difference between 30 and 31 is that there's another rest home with an
I'm
outbreak?
asking if there are any confirmed cases of COVID-19 at rest homes in addition to Matilda Smith Williams
Not to
and
my
to
knowledge.
Westmeath.
No, not to
Is
my
that
not to my knowledge.
To the knowledge
In
of...
residence, you're talking about. Yes.
Right. So is there any clarification that
When
can be
there is an infection identified in a resident in a home, we will make that announcement.
To date, how many residents and staff total have been tested for COVID-19 at the island's 21 care homes?
I don't have that figure.
Does anybody
But those
have
are
that
questions that you can easily email and we can give you the figures.
With the greatest amount of respect, a number of these questions that I'm asking tonight have been previously submitted to government.
Well, we'll have to get back to you. Apologies that I don't come with the information tonight.
Just one additional question, if I could, just one.
Good afternoon, good night, good evening, I should say. Premier Burt, I need to ask, has there been
You got to speak up, Trevor. It's hard to hear you.
Okay, 1 minute. Premier, has there been any complaints coming from the Ministry of Health regarding illegal testing of family members by Dr. Bowden to your office?
I have no idea what you're speaking about.
Okay. I was sending a petty request on this particular incident that I've talked about. TNN understands that the BTA upper management are planning to take a 20% pay cut, and they're asking the rest of the staff to take a 40% pay cut. Have you discussed with your cabinet thus far yet? Have you discussed with the cabinet about taking a pay cut?
Yes, that is a matter that was discussed in the cabinet yesterday, and what I had said when asked the question previously last week here, that the Minister of Finance is examining all options of what we're going to be placing on the table when it comes regarding government measures of austerity and cutbacks.
I wanted to ask Dr. Health Minister, why would you consider you taking over 2 weeks to identify that second facility, which was Westmead?
As I mentioned previously, and I was actually quoting Dr. Peekball, and you would have been in attendance when she was here previously, the public health team did not feel that the disclosure of that particular rest home at the time warranted any type of public health notification because it didn't present as a public health challenge, unlike the other rest home. And that was what was mentioned when that question was previously asked of me, and Dr. Peekball made that same reference last week when she was here.
Well, back on April the 10th, you did identify the one patient at Matilda Smith, and you said Matilda Smith, and you said another restroom and didn't identify it. So I'm trying to get the comparison. Why identify one and not the other?
Well, like I said,
and that's the questions that are being asked.
Certainly, and like I said, Trevor, and that's a very good question, but when we did identify that there was a person that tested positive at another particular rest home, as Dr. Peepal said, it did not warrant a public health response, so to speak, insofar as disclosing the name of the facility because they didn't feel that it was in the best interest from a public health perspective. As she's indicated, and as my statement said, that individual was identified, they were properly quarantined, and the few persons that were in contact with that person were also equally quarantined.
A staff member. So we have made the decision that when there is an infection in a resident, that we consider that an outbreak, one case of COVID-19 in a resident in a rest home, and we will make the announcement at that time. And it's very relevant because a lot of public health action then has to take place because these individuals are vulnerable and are in an enclosed space. But if there is a case of COVID-19 in a staff member or a family member who visited a nursing home, those are not the kinds of things that we would make a public announcement around.
Premier, with another flight coming in on Friday, do you consider we are bringing more possible positive cases, one, and two, I understand that 3 individuals coming in on this flight have requested through the health ministry to be quarantined at home, and they were simply given the okay through an online request process. Why give permission for individuals to be quarantined at home and you're putting others at other facilities?
Well, I'm going to let the Minister of Health speak to that, but I would say in a very basic aspect, it's following the law and as the law is written out, Trevor. And so this isn't the first instance, but the Minister of Health will speak to that in more in depth. What I would say on the question of when you say, is there a risk of introducing more positive cases? Mm-hmm. The only thing I would say to you, Trevor, and to any Bermudian watching, if it was your family member that was stranded overseas, that couldn't get back home, that was struggling, that was destitute, that was without a dorm, that was basically to a point in time they were homeless, you would want the leader of your country to bring them home too. So we're going to do what is right. There are persons who are stranded in the United States who are going to be getting on a private jet tomorrow and will be coming into a quarantine facility in the exact same way. When you talk about introducing positive cases to Bermuda, mm-hmm. For the UK flights, we had 160 persons on there, and at the end of the quarantine period, we only had 3 persons that tested positive. The fact is that through that particular process, we are managing the risk, and that is what you have to do in an outbreak, or inside of a situation like this. It is unreasonable to expect that we are never going to have any cases in Bermuda. That is not what we're trying to do. And the only way that we will never have any cases in Bermuda is that if we leave our airport closed for 18 months until there's a vaccine and vaccinate the entire population. Neither of those things are going to happen. So we are going to have to work on managing this crisis and making sure that we have the requisite tools at our disposal in order to make sure that our healthcare system does not get overwhelmed. On the issue of quarantining the law, I'll defer to the Minister of Health.
Okay, thank you, Premier. Under the legislation, there, as the quarantine authority, which is the Minister of Health, there are certain provisions where an exemption for quarantining in a government facility can take place. First and foremost is it only applies to persons over the age of 18. So there are a number of unaccompanied minors on the plane who, for obvious legal reasons, would not be required to quarantine in a government facility. And secondly, if the person is able to satisfy that they have, for medical reasons, it would not be appropriate for them to be isolated in a government facility. On the form to which you're speaking of, details have to be provided insofar as what is the request, what is the nature of the request, and effectively provide the defense to it, such as providing supplemental medical information and confirmation of the medical condition.
Thank you very much. Bermuda Broadcasting.
Good evening. How many total passengers disembarked from the last Delta flight from Atlanta, and how many from the BA Air Bridge? And then the second part, or there's two questions, and how many of the newly imported cases came from the British Airways flight, and how many came from the Delta Atlanta flight?
I can give that summary, as I know I posted it, but the question of which you're asking, Don, regarding the total number of persons in the flight, that's certainly something of which I'd have to get back to you on, because I don't believe that I have that particular answer for you right now. But if I go off the top of my head, out of the 11 positive cases that were announced yesterday, 3 were on the British Airways flight, 4 were on the Delta flight, and 3 were on the charter flight that brought back the cruise passengers. I think I did put that on my Twitter account. And I'm speaking from memory because I can't pull it up that fast, but I think it was 3 on the BA flight. And I think there were about, how many Bermudans we had on the flight? About 160? About 160. I don't remember, I think it was like 60 or 70 people on the Delta flight. We can get the exact numbers for you afterwards. And I don't remember how many people came in on the cruise ship that was stranded, but it was 2 planes, so probably about 20 or so.
All right, thank you. Last night, again dealing with the 11 new cases popping up at once, adding to the one earlier infected case. How many days into their 14-day quarantines were the passengers swabbed with the PCR?
It actually varies because remember, the process includes the doctor making a request, so they may have all come together on one plane. So, for example, those persons that came, and I was just doing a quick calculation while the Premier was chatting, those persons that came on the flight from the 8th of, came in on that flight from the 8th of April, persons tested positive between the 11th and the 21st. So it just varies when they went to their doctor, when they started exhibiting symptoms, went to the doctor, and had the doctor make the requisite request for the test.
Mr. Premier, but the question is probably more for the Health Minister. You very candidly admitted this evening with regard to the community sort of being a little angsty, would be, I guess, a nice way to term it, on social media today. But there were many complaints from the public that the government should have mandated regulations for the rest homes instead of recommending them back in February. The things like mandating staff only working at one home and making them wear PPE. In hindsight, would you do anything differently?
That was a similar question that was asked the other day, and I thank you. I mean, hindsight is obviously a valuable tool if we all had it. However, recognizing, based particularly on the information that was coming from epidemiology and surveillance as it related to certain trigger events and what we were seeing on the ground, when we recognized that there was a potential of cross-contamination, so to speak, with respect to persons moonlighting from one rest home to another. The government moved swiftly and entered into those regulations that we passed last week.
Again, many people on social media today are pushing back against the government labeling its early testing regime as aggressive, saying the government was hampered by a shortage of tests to do truly aggressive testing. How would you respond to that?
I would respond to that by saying that if you look at a lot of our competing or similar jurisdictions, our testing numbers currently are higher than that. And so we are going to continue. We've done a pretty good job, I think. And the fact that we are able to now open up a drive-through testing facility on Friday, and we have the capability to do a number of tests, there would be naysayers every day, Don. And the fact is, if we could wave magic wands and make testing supplies appear in front of us, but I'm sorry, if there are massive, larger countries that actually manufacture tests and have the ability to do that, and they have testing problems, I think we're doing pretty well. And so from a percentage of our population, we may not be as high as we want to be, but the fact is that on Friday, we're going to start testing essential workers and our police officers and our regiment persons on the front line. And there's a lot of countries who can't do that right now. And so I think we're in pretty good stead. And there's always going to be naysayers, and there's always going to be someone who's going to say, oh, they're not doing a good job. People might do that for their own reasons. We are doing the best we can, and not only are we doing the best we can, I actually think that we're doing a pretty good job of it. All right. With Don got 6? Okay. All right. With that, I would like to thank everyone for their attention. We will be back here on Friday evening. Take care of yourselves and have